You look down on your leg and you see this little blue vein, or maybe these little streaks that seem to be appearing all over the lower leg or up on your thigh, and you wonder what the devil is going on. Well, stay with us for this segment of Kentucky Health and find out.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about disorders of the vascular system. In particular, we're going to talk about disorders of the venous system. And with us is Dr. David Lipsky of Louisville Vascular Specialists. Dave, thanks for being with us today.
Thanks for inviting me.
Now, I guess I got to start off. What are veins, and does everybody have them?
Veins are, yes, everybody has them. Veins are the blood vessels that bring the blood from the various body parts that we have, like our legs, back to the heart.
So are they in all parts of the body, and they're all different sizes and shapes, or how does it work?
Exactly. The veins of the legs are shaped like upside down trees, beginning with the itty bitty twigs, leading to bigger branches, to bigger limbs, finally to main trunks.
So the blood that they carry, is it oxygen and nutrients in it, or does it tend to carry more waste material?
More waste material. The arteries are the blood vessels that carry the oxygen and the nutrients to the various body parts, such as the legs. And then the veins bring it back so the whole cycle can start again.
How does that blood get, I can see it leaving the heart, going through the arteries and everything to get down into all parts of our body, but how does it get back to the heart? I mean, what's the force that pushes it back there?
You're right, the heart is pumping the blood in the arteries, but the veins rely on breathing. When you inspire, it sucks the blood from your legs. And plus, we have a complex and ingenious system of one-way valves, such that those valves open up to allow the blood to move the correct direction, but then close to make sure that the blood doesn't go the wrong direction under the influence of gravity.
Oh. What about I see people every now and then wear these stockings, or they're exercising their legs. Does that muscle push things back up too?
It exactly does. Just like the heart is a muscle in our chest that squeezes and pumps the blood into our arteries, the calf muscles act as a pump around the veins in the calves and pump that blood against the force of gravity so the blood returns to the heart.
How common do you see problems with the veins?
Vein problems are one of the more common problems of people on Earth, as a matter of fact. It seems like vein disorders are common among all different cultures and indeed all different times.
Do you tend to find it more often in women than men, or children than adults, or does it matter?
Exactly. It seems like it's more common in women, and for that reason people have postulated that there might be a hormonal cause to it. Sometimes people wonder about family history as well, because certain individuals will say that, oh, I've had my mother and her sisters and my grandmother have had veins, and so that also seems to be important.
Now, is it a factor because we're an upright person? Do you see vein disorders in other animals too, or is it just, again, because we're standing upright?
It is partly because we are upright, but it's interesting that you would ask that question because one of the tallest animals, incidentally, that is a giraffe. But as it turns out, a giraffe's skin on its legs is very tight. So despite the fact that giraffes are very tall, they don't get varicose veins. It's as if they have built-in stockings.
So what are some of the causes of problems with these veins then?
We really don't know a lot about what causes vein problems like spider veins or varicose veins. Another segment of problems has to do with blood clots, because people can develop blood clots in their veins. And in that circumstance, the blood has an easy way to get into a person's leg, for example, but then has a hard time getting out. So that would be a whole nother cause of vein troubles.
So what is a blood clot then?
A blood clot is a natural phenomenon in which a person might sustain an injury to a blood vessel, and of course you want that blood to stop bleeding, so your body makes a blood clot, and that's healthy. But sometimes we don't necessarily have an injury to a blood vessel, we're not bleeding, and you develop spontaneously a blood clot, and that's bad, that's a disease.
Now, you mentioned earlier about these valves that occur in the veins. What you said, they open up so the blood goes up, and then they shut, I guess, to keep the blood from coming back. Do those valves always work, or can they fail on you sometimes?
They fail, and it's not really understood why. Whether a person's vein might dilate so that even the normally functioning valves no longer touch each other the way they're supposed to, or whether the valves just are extra weak in certain individuals. But you're right. The main problem is that these valves fail, and then they leak, and the blood goes with the force of gravity against the normal flow, and that causes all the problems.
Can you get infection in the veins?
That's usually fairly uncommon. More common among people who have IVs in their arms, or sometimes we have to put IVs in people's chests for certain special medicines, and in that circumstance they can get an infection, but otherwise it's pretty uncommon.
And that's what phlebitis, I guess.
That's, yes,
because you hear about that every now and then.
Sure.
Okay, so it's not really an infection, it's just there's some inflammation there from the thing being irritated?
That's right. That's that itis suffix. It means inflammation.
Now, I guess in my mind's eye, I can think of a lot of different ways in which people can present with this. But what are some of the more common things that you see when someone comes in and they have some venous disorders?
One of the most common presentations is a person will come in and will say, I have some abnormal looking veins on my leg. And I would say just in my practice, it's about half and half. People will say, I don't like how they look. They don't really bother me in the sense that they're painful or my leg isn't swollen, but they just dislike how they look. In the other half of people, they will be having problems, symptoms like aching and throbbing in their legs, heaviness, swelling, or in certain circumstances can have inflammation of the skin, almost a rash, or in the worst circumstance, even an open sore. All from vein troubles.
Now, what about in this first slide that you brought with you today? What is it that we're seeing in this individual?
Yes, the first slide I brought is a fairly subtle picture of a spider vein. And the reason that I chose that slide is because it would be very typical for a person to be bothered by the appearance of this spider vein, because it would occur, for example, in a woman, and she said, I'm just so self-conscious of this. I don't like to wear sandals. I don't like to wear capris. And doctor, can't you help me to make this disappear?
Now, it's called a spider vein because it looks like a spider? Or?
I think it looks like a spider's web is what I'm imagining.
Okay. So now, are these veins just on the surface, or is this something that's down deep?
They're right on the surface, and one of the characteristics of a spider vein is it's actually in the skin. So you couldn't take this out even if you wanted to, any more than you could take the holes out of a sponge. And so you have to treat those spider veins where they are.
Okay, now what about this next slide that you brought with you today?
I chose the next slide because it depicts a more dramatic appearance of a spider vein, and in fact it's a variant of a spider vein. And just to orient you, it's a person's thigh, outer part of the thigh, and their hip is toward the left and their knee is toward the right, and they get this linear streaking appearance of the spider veins, and they are larger, more dramatic in appearance, but yet at the same time there's still those little veins that occur in the skin.
Now, is this a painful thing?
Can be. Sometimes those spider veins, as I say, can cause a person to have stinging pain or burning pain. But probably one of the most dramatic things that can happen with these spider veins, say in the case of the second person of the slide that we saw, where a person, the skin will be so thin over that abnormal vein that the skin can, say, break open and a person can actually have bleeding. And for example, this week I saw somebody who is taking a shower and look down, and all of a sudden they have this blood in the water, and it's very upsetting to people.
Other than, say, that scenario, are there any other more serious sequelae that can occur in a person who has the spider veins or anything? In other words, is it a sign that something really bad is about to happen?
Generally not. generally not. It's an isolated problem, and if a person isn't having a lot of trouble with their legs, they can move right to treatment and not worry that there's a deeper problem.
Now, both of these examples you brought were from the lower extremities.
That's right.
Can you get them in the chest or the arms or anything like that?
They're fairly unusual in those locations, and it's probably a gravity thing because the legs are the parts of our body that are down the lowest, so the blood has to travel the farthest to get back to the heart. But there are certain circumstances, say if people have blockages in their main veins of their arm, the other little veins on the skin might become more prominent.
Okay. Now, what about this third slide that you brought in? Now, what does this patient tend to have?
I brought this slide because it shows really what a varicose vein is. It's a large, bulging, ropey vein. It might have a greenish appearance. And if you look at the skin, you can actually see the veins. And so that really helps a person to understand what is the difference between those little squiggly spider veins and these big, ropey, green varicose veins.
So what is the significance then when you see a person with varicose vein?
Varicose veins don't generally occur just with a problem in that vein. There's often another vein beneath the skin that's abnormal. So in the case of a varicose vein, there may be another problem deeper. Sometimes we can detect that on examination. Other times we have to do other testing.
So you'll have veins then that are under the surface, and then you have other veins that are even deeper down?
That's right, and they call those the deep veins because they're in the muscle compartments and surrounded by the muscles themselves. But these varicose veins are superficial, you're right.
Now, is there any problem that when you start seeing, I assume that when you say varicose, you're not meaning very close to the skin, but rather varicose.
Many people confuse the two, but technically it's called a varicose.
Okay, so being up there like that, when you see that, so automatically you have to think, okay, there's a problem with these deeper veins, and is there any other problem that may come to the person further down the road just because they have this?
They may not have a problem with the deepest veins, what we call the deep veins, but there are other deeper veins that are still in the superficial system, and that may be where the problem is. But it's not necessarily a health issue, and generally if that woman whose leg I showed, if she comes and says that my leg doesn't really bother me, but my husband is just worried about me, and so he's making me come. I would say I can reassure you that these veins are not a threat to your life or to your health, and if they're not bothering you, there's no reason to be concerned.
Well, let's go back to the question about clots, which you brought up earlier. We know then that patients who develop these clots in these veins can break off and they get pulmonary emboli, which can be life-threatening. Are these veins on the surface, are they the kind that can form these clots and go on and cause emboli?
You're right, that is a serious problem when a blood clot migrates to the lung, but generally speaking, those clots come from the deep veins. They're bigger and there's more blood flow, so it seems as if the pressure can cause the clots to push off and then end up going through the heart to the lungs. But most of the time, varicose vein, if you have a varicose vein and it has a clot in it, it won't migrate and it's not a threat to you.
How do you know if you have a problem with the deep veins then?
Deep vein problems are most often seen in people who have had blood clots. And because what will happen over time is the clot will partially dissolve and go away, but it'll damage those valves. And the deep veins are the important veins. The superficial veins are important because they can become varicose, but that's not a bad problem. But when you have a problem with the deep vein, that can cause a person to have more serious health trouble.
Now, I can seem to recall a lot of women who are pregnant will have these big swollen legs sometimes. Now, what is happening that they'll have that condition with them? Is that because they have vein disease?
Not necessarily. There are three reasons why pregnant women tend to have problems with their veins. Number one, their blood volume goes up because they have to be getting blood circulation to the placenta to make sure their baby gets enough nutrients and oxygen. So there's more blood, and the blood generally sits in the vein system. Number two is there are hormones that the placenta makes that says to the uterus, relax, relax, it's not time for the baby yet. Well, guess what? The veins hear that hormone signal and they relax, and so the veins dilate. And then finally, in the third trimester, just before a woman gives birth, the baby may be pressing on the veins in the pelvis, so the blood inside the veins of the legs has a hard time coming up because they're being squished upstream.
So just because a woman has some swelling in her legs during pregnancy, does that necessarily mean she'll have problems down the road?
Not necessarily. Most of the time that goes away, or at least gets better such that it's not a problem. But on occasion, a woman might comment to me that with each child, this is the vein I got with Jimmy, and this is when I had Tyler, and so on and so forth.
So you can't see that.
That's right.
Okay, someone comes to you with this spider vein because they just don't like the way that it looks. What do you do for it? Or can you do anything for it?
Something can be done, and generally the best treatment is to do a procedure we call injection sclerotherapy. And the idea is that we use a very small needle and squirt a medicine inside the vein to cause it to collapse. Sometimes people think about laser treatments, but in general it has been my observation that lasers are good for very small veins. But when veins are a little bit bigger and of the nature that people usually have when they come to see me, laser treatments don't work.
Now, are you doing this in your office?
It's an office procedure. It's easy, and I generally try to have a distracting conversation and try to tell jokes, and before you know it, we're finished up. And it stings a little bit, and I'm not denying that, but people usually are tougher than they imagine.
How long or how large an area can you do?
I can often treat most, if not all, of the person's veins in one setting. And of course there are people, for example, like the gal who I showed in the second slide, where she has just a humongous number of veins. That might take 2 or 3 treatments, and we might limit ourselves to one leg at a time, for example.
And if the person had that tingling sensation that you spoke of, will it usually go away after this?
It usually does.
Is there a scar or anything that's left over after you do the sclerotherapy?
The little punctures are so small they heal without a scar, and when the veins disappear, they often don't leave any scars either.
So when we're looking at that spider vein, is that blood that's in there that's causing that discoloration?
And the blood isn't really moving, so it gets real dark and it's real prominent, and particularly in light-complected people, say from Northern European, where they have that very fair skin and very blonde hair, it becomes very apparent.
Now, what about the woman that you had that had the varicose vein? So you have this large, ropey-looking thing. Are there anything that you can do for that?
Absolutely. We usually begin with an ultrasound test, and the purpose of the ultrasound test is to tell us which veins are working normally and which veins are not working normally. Despite what a person might imagine, these vein abnormalities occur in predictable patterns, so it's just a matter of figuring out what pattern does a person have and then applying our treatments according to what pattern we observe in that person. And do you know what? Sometimes people have they'll have veins in both of their legs, and there'll be different patterns in the right leg than in the left leg.
So what kind of patterns are you speaking of?
Well, most of the time there's a vein abnormality in what we call the main or great saphenous vein, and that's a vein that starts off on the top of your foot, comes up by the inside of your calf, by your knee, and then ends up in the groin. And that's usually where the trouble starts, and people will have lumpy veins on the inside of their calf and thigh.
And that one vein goes that long distance.
It's the longest vein in the body.
Okay, what other patterns might you see?
Well, sometimes the veins can travel diagonally across the thigh, like the lady in the slide. And when you see people, oftentimes you still need to do the ultrasound test to be certain, because sometimes even if you know what you're doing, you can be fooled. But generally speaking, I can take a look at a person and just have, at least in the back of my mind, this person might be a candidate for a catheter type procedure. This person might be a candidate for an injection procedure, or maybe surgery is going to be the best thing for this person.
What about the use of the compression stockings and these sorts of things? Is there any value to that?
Yes, and it depends on what a person wants. And if a person says, my legs are just kind of achy and fatigued, but I'm really not interested in surgeries or anything or any procedures, I just need something to help me get through the day, stockings are a great way to manage that. Of course, they're not curative, they won't make the veins disappear, but sometimes the stockings are helpful in as much as a person might have to go through a stocking trial in order to be able to show the insurance company that, yes, it's medically necessary that I have my veins treated.
I'm going to ask you more about the surgery in a minute, but what happens when that person that has these, and I've seen these, I'm sure many of us have, they'll have these really, really large dilated veins, as you point out, I guess the greatest saphenous system, and they're just really huge. Now, left untreated, what is the usual outcome of that as these veins get larger and larger?
It's difficult to predict, and usually the best way that I have to answer that question is to ask the person what's been going on, because that's a frequent question I get. And I just tell people, look, I can't predict the future any more than the weatherman can predict the weather, but it's often the case that current trends continue. And a person who comes in and says, yeah, I've had these humongous veins on my legs and they've been there for 10 years, they haven't changed a bit, and I'm here just because, my wife is concerned, then I can say, well, I'm going to predict that these are going to stay the same and never cause you trouble. But more often, people will come in and say, yep, I didn't have this vein last year, and now look I've got this vein. And my legs didn't really bother me all that much last year, but now this year, I'm really finding that I'm sitting down more often. So then I say, well, I'm going to predict that this is going to continue to get worse.
When you think about the surgical options, and you said the catheter treatment and a few others, what are you trying to do?
Well, generally speaking, you just have to eliminate that backwards flowing blood that we talked about. And it's very difficult, if not impossible, to fix the valves, which would be what a person might think to do. But in fact, what you often have to do is either remove that abnormal vein or seal it up from the inside with a catheter using heat energy, where you sort of shrink wrap the vein on the inside, so then there's no chance for there to be any backwards flowing blood through a vein that's sealed up. And then the blood has to go to the normal veins, which is going to carry the blood back to the heart normally.
Will those other veins then get bigger?
Not necessarily. Actually, it's the veins get smaller because they don't have to be carrying all the backwards blood that leaked down in the wrong direction, so they only carry the blood up and back to the heart one time.
So, what are some of the things that you tell people to prevent them from getting vein disease or venous problems?
It's very difficult to prevent vein disorders, and I try to alleviate people's guilt a little bit, if you will, because people say, "Oh, doctor, I know I should be wearing my stockings," and I tell them, look, I could nag you and say, oh, yes, you're right, you should be. But in point of fact, studies have been done in effort to try to define, do stockings really prevent vein disorders? And you know what? The answer is, we don't think that they do.
Really?
So, but I tell people, look, if you wear your stockings and you can wrestle them on and you like how they make your legs feel, why then please do, and you can feel good about that. But otherwise, you don't need to feel guilty about not wearing the stockings.
What about sitting down for extended periods of time and crossing the legs?
People have tried to answer that question as well, but then you get into the chicken and the egg problem, because people have done the studies and said, sure enough, it's more often the leg on top that forms the varicose veins. But then I was at a meeting and then someone raised their hand in the audience and said, well, do you think that was the result or the cause?
Sitting down and letting the legs hang down dependently for long periods of time.
Might cause people to have swelling in their legs, but not necessarily varicose veins.
Standing up for long periods of time and not moving.
Well, same thing. I think that it might cause a person to have swelling in the legs, but I don't know. I think it's hard because a person, say, for example, who would be a hairstylist or a clerk in a department store or a nurse or a teacher, those tend to be professions in which women are, at least right now, are more commonly represented. And it seems like I see a lot of people. So there might be something to that, but if it's your job, if it's your career, it's hard to get around, isn't it?
Is it important to move around frequently?
It generally is. And when I tell people, especially, and not if they can't move around, at least to pump their legs, is when they're on an airplane or on a bus trip or a long car ride, and they just sort of pump those legs just to circulate the blood, and it helps prevent blood clots. Varicose veins, I'm not sure, but blood clots, absolutely.
So with that in mind, then, is there any particular time you say, well, okay, if you've been sitting for an hour and a half, 2 hours, you should get up, walk around, or pump the legs, or you don't think it doesn't matter?
Hour and a half to 2 hours is a great suggestion, and that's what I tell people.
Must be fun riding with you on a long trip then.
Well, no, you don't even have to do it. No one needs to know you do it. You just push down on the gas, let up on the gas, push down. And of course, not if that foot is on the gas pedal, I guess, but you know what I mean.
Sure. So when you have these small little spider-like veins, that doesn't necessarily mean anything terrible is going on. It's more of an aesthetic problem than anything else.
That's right.
And it's easy to treat.
Absolutely.
Just using the injections.
That's right.
The saphenous vein thing, when you have the big curly vein, a little bit bigger deal, but still easy to treat.
But still very manageable, and it's one of the most satisfying parts of my practice. People are so grateful when you make their legs feel better.
Well, Dave, I want to thank you very much for being with us. I think it's been rather interesting to talk about some of these little venous diseases. A lot of us have them, but sometimes we don't necessarily address them as we should. But there are things that we can do for them, not only from the aesthetic, but also from preventing certain problems like clots and all that down the road. If you have questions, feel free to contact us here at Kentucky Health at kentuckyhealth@insightbb.com. We enjoy hearing from you, and we'll be more than happy to answer if we can. Of course, also feel free to contact the good folks at Louisville Vascular Specialists. They'd be more than happy to hear from you, and in particular, Dr. David Lipsky, if you have a problem with your legs and you want to know what to do with those veins. Thanks for being with us, and we look forward to seeing you on another segment of Kentucky Health.